So, okay. So quickly we'll look at this aspect of the customer service. So this model is to help to identify the various customer group or within the lab, develop method to measure customer satisfaction because measurement of customer satisfaction is key, and development of solutions to customers' service problem. Then list down the advisory services that is provided by the laboratory. They discuss how quality management process help the laboratory meet the customer's requirement. So my name is Dr. Ali Ibrahim, and I will be going through this objective in our customer service section today. So if you can hear me, please type on the comment section that you can hear me loud and clear. So if you can hear me, just type on the comment section that you can hear me. Okay. Okay, thank you. So customer focus is part of the product quality system essential. Now, the question is, out of 26 uh, unhappy customers complain. This is from AROP research. Why one dissatisfied customers will tell between 9 to 15 people about their experience. Now, so a lot of people who are disgruntled about their services, a lot of people who have complained about their services will end up not telling you or will not complain. So from these statistics, about 1 out of 26 unhappy customers will complain. Now, one dissatisfied client or one dissatisfied patient will tell between 9 to 15 people about what their experience. Now, quality is meeting customers' needs. These are explained in the earlier model, according to Philip Crosby. So when we don't meet our client needs, when we don't meet our patient needs, definitely that is not quality. So quality has to do with meeting what their need. So the whole essence of the quality, the whole essence of the customer service, the whole essence of the personnel, the whole essence of the equipment, the whole essence of the process is to ensure that customers' needs are met. Now, a good customer service, the ultimate goal for the laboratory is to meet the needs of the customers. So customer service is an integral part of what the quality management system. A good customer service provides a valuable information for best patient care, valuable information to improve surveillance, and enhance the professional image of the laboratory or any organization. Who is responsible for customer service? This we have established. Everyone is responsible for the customer service, including the phlebotomy, the technician, the, the laboratorians, the doctors, pathologists, everyone that has one or two things to do with patient management is actually responsible for the customer service. Now, there's one called service agreement. This document clarifies the laboratory service to be provided. Now, each request accepted is an agreement or a contract. No, this is for like agreement to provide laboratory service will cover the request format, examination required, resources needed, report format, capability of the lab to provide the services the customers need, notification on deviation from the initial agreement. So let's say, for example, the lab has services an organization, or services a hospital, or services an individual, or let's say a body. There should be a service level agreement between the lab, between that organization and the other organization. Now, that document should clearly specify the request format, how would the request be made, the examination that is required, resources needed, report format, and etc. So this service level agreement helps to keep the contract between a provider and one patronizing such services. Now, who are the clients of the lab? This we have established earlier. We have the clinicians, we have patients, the public health environment, the public, the environment, health agencies, and etc. Community, all these forms what the client of the lab. Now look at this carefully. So this is going to be one of your activity. Work in your group, or if you're not a group, you can work individually. Come up with action to meet customers' requirement in the 3 testing phase. Now, the pre-analytical phase, please look at it, the examination phase and the post-examination phase. Now, what are the actions you think you need to meet customers' requirement in this phase? Now, use your organization as what? As a case study. What do you think? What do you think that should be done within the pre-analytical, between the analytical phase and the post-analytical phase for your organization to meet what the customers need? Did you get this? Did you get this activity? So I'll give you. Hello, did you get the activity? So I'll give you like some few minutes. Just think about some of them. Then later, you're going to put it in a writing and send to me. What are the things you need to do within your organization, within your department, is to ensure that you meet the customer's need? What are things you need to do in the pre-analytical phase? So you need to look at those bottlenecks. What are the things that we are not getting right? What are the things the department is not getting right? What are the things that we need to start doing at the pre-analytical? Or when it comes to the sample collection, looking at your ambience, looking at the waiting time, looking at how sample is being processed, everything. What are the things that you need to start doing within the examination phase? What are the things that you need to start doing at the post-examination phase? So look at these things, you think about them, you put it in writing, and you share with me. Now, customer requirements for clinicians and public health agencies. Now, what are the requirements? What do the customers actually need from the lab? One, they need an accurate and reliable result. They need a result that is consistent. They need a result that is timely, and they also need professional advice. So remember, we said 3 things define the quality of any laboratory result. 1, the accuracy, the reliability, and the timeliness. So these 3 things is what is quality to them. So accurate result, valid result, a consistent service, a timely result, and professional advice. Now, in meeting the community requirements, we talk about things like biosafety, biosecurity, containment, disease alarm, surveillance, response, waste management, transportation of dangerous goods, and etc. Now, meeting customers' requirement, please look at this. The pre-analytical. Now, I'm taking it into the process for you. You need to constantly update your test menu where you have additional tests, where you don't have tests that you are no longer doing, tests that you cannot longer run, tests that you have added to your platform. Sample collection manuals. You will need a sample collection manual. You will need a requisition form, a standard requisition form, and timely delivery system. Now, in the examination phase, what are the things that you need to meet customers' requirements? You will need competency personnel. If your scientists or people doing the analysis are not competent, definitely you are going to have disgruntled clients. You need to test method and validate them. You need to validate your test method and verify them. You need to have a good quality control program. You need to have quality assessment. You need to have good sample management, process management, and non-conformance management. Why do we need non-conformance management? So that any non-conformity that is being done within the analytical phase can be addressed because every non-conformity has a way of affecting the patient satisfaction or the client satisfaction. So you will need a non-conformity management. What are things that you need to also address at the post-analytical laboratory information system? In other words, how is the result being delivered to them? Is it manual? Is it paper-based? Is it computerized? Then other things, are the result accurate? Is it clear? Are the result ambiguous? It must be unambiguous. As the result verified, is the result timely released? Is it properly timely delivered? Is it accurately delivered? The way you report the test, is it a standard reporting format? Do you have a system for notifying clients when they have delayed results? Do you have a system? You need to have a system that notify the client when they have a delayed result. You need to have a system that notify the client when you have critical results. I hope you know that part of the services that you should be that you should have a way of handling critical results. If a patient comes in for a critical test, and let's say, for example, you are doing a CSF samples, or for example, like a blood culture, you should be able to notify the client on each day, day 1, day 2, day 3, day 4, day 5, until the final result comes out. I'm just speaking this to be specific. Let's say, for example, there are other tests that also may require you reaching out to the client because of what is a critical result. What is your retention and record time? How long do you keep the test report? How long do you keep the information within your systems? All this has to be addressed for patient not to be what disgruntled. Can you hear me loud and clear? If you can hear me loud and clear, type on the comment section that you can hear me. Yes, okay. Thank you. So, meeting patient requirements, you will need a reliable information system, information to communicate to them. You need safety, comfort, privacy, and competent personnel at least to be able to meet your patient requirements. Now, because there's the patient, when they come to the hospital or come to your lab, it should be safe enough. They should have some level of comfort, at least, especially in developed countries. They should have what, or in developing countries, they should have privacy. We should also have competent personnel at every aspect, from the pre-analytical to the post-analytical, that ensures they deliver what customers want satisfaction. Now, meeting patient requirement, you have to provide current laboratory information. Very important. Some of us, some labs do not provide current lab information. Lab information could be what is already existing, what is like different methodology, tests available, kits availabilities, and etc. Provide sample collection guidelines. So let's say, for example, now somebody is coming for sample collection, and let's say, for example, the person is to fast, also abstain from some exercise. Let's say, for example, now you are collecting a semen for semen analysis. Oh, the days the person needs to abstain has to be communicated. How to collect the sample has to be communicated. So you need to provide sample collection guidelines. Train the personnel. Trained and knowledgeable personnel are very, very important. You need to assure confidentiality of records. So every record of the patient, every record of the client must be confidential. Maintenance of record, provision of advisory services. So the lab should also provide advisory services to the patient, whether it's being free, whether it's being paid for, but the most important thing that it should be available. Comfortable waiting and sample collection areas. So these are things that can cause clients being disgruntled, clients not being satisfied by the way we manage them. So what are the advice on collection requirements? Please, these are some of the things you must look at. Patient identification, patient preparation, type of sample that is required, type of container that is needed. Because there are some persons that know these containers by colors and not even by the name of the container. So these things have to be well spread out. So the labeling, specially handling, safety precaution, waste management, and etc. Collection requirement and guidelines. Key information for the laboratory users like the name, the address, the directions, contact person, contact information like phone number, emails, working hours, list of your tests, expected turnaround time, because so that the person will know when he or she is expecting the result. Complaint procedure, signature, directions, signage, directions. Signage can show, okay, this is the restroom, this is the grading room, this is the phlebotomy room, this is the waiting room, this is the lab, etc. Then bilingual staff where applicable. Let's say, for example, now the local dialect of that place where you are. Maybe if the person does not understand English and understand French or understand that local dialect, you should be able to provide such services where the person can be able to communicate and receive communication. What are the advisory services? Establish arrangement to provide advisory services, choice of the test method, use of the services available in the lab, individual cases, professional judgment on the test result interpretations. Those are part. There are some persons that okay, for the interpretation of your result, please consult and so on. They won't have a services after testing the clinician or whoever that is assigned to do that can also interpret those results, promoting effective utilization of the laboratory services, consulting on scientific and logic matters. Now, please, very important, when establishing the customer satisfaction program, what are the please, can you mute your mic, please? When establishing a customer satisfaction program, what are the things that is needed? Very important. One, you will need commitment. Two, you will need to plan. Three, you will need knowledge. Four, you will need resources. I want to talk about commitment. All staff must be strongly committed to the process. And customer satisfaction is driven from top to bottom. From this, management must be involved. Everyone must, in fact, it has to be driven, just as the way I explained in our previous sections. All staff must be strongly committed to the process, because any staff that is dropping the ball will definitely affect the entire process, the entire satisfaction of the customer. So if the analytical department is dropping the ball, to affect what? The customer satisfaction. If the analytical personnel are dropping the ball, it will. If the support services are dropping, it will. Every aspect has a way of affect. So all staff must understand their commitment to what? Meeting what? Customer satisfaction. Number two is planning. Avoid inadequate and uninterpretable information. You have to plan. What I think that is needed to be done. How should it be done? Who is to do it? When should it be done? That is planning. You document those plans and you also implement those plans. Next is knowledge. Creation of monitoring tool required for specific works, knowledge. The resources. You need money, you will need finance, you need humans, you need equipment, you need technologies to be able to drive what? Customer satisfaction. I remember one of the places I once worked. So I discovered that when people come into the place as a manager, then when the people come into the particular place, the reception, we always have these people being disgruntled. Oh, I came first. Oh, I came last. Or I came before you. Can you have a fasting test I need to do? Please, can you just allow me? So what I did, we bought a red system, like a tally system. So once you come in, we give you a tag. We'll give you a tag. We print tag 1, 2, 3, 4. So we have like 5 counters for receiving. So we press the bell. It's okay. Number 4 come to counter 5. So without all those, I came first, I did not come. Oh, I came before you, ended. Those are what? Technologies. So, and then we could even analyze the waiting time for various clients that came, and also so it helped us to improve a whole lot of things that we do then. What are the methods of assessing customer satisfaction? This is very, very important, and I want you to take note of this. How do we assess customer satisfaction? Number one, we assess customer satisfaction by having a complaint management. Then compliment, interviews, and focus group, then satisfaction survey. Now, complaint management is having a process, that addresses what? Complaints. So you need to have complaint resolution form. Is that clear? You need to have what? A complaint resolution form. Hereby, any form of complaint that is stated there, you put the complaint, then you do a proper root cause analysis, and you do a corrective actions. And there must be an evidence that complaint has been cleared by your end. It's a quality requirement, and it's also an accreditation requirement. Next, compliment helps you. Interview or focus group. You can decide to interview one or two customers or a group of customers or a particular set and know how they feel about your services or your product. Next is satisfaction survey. So survey, you can create a survey. I will show you how to create. You can create a survey. A survey could be a paper survey, could be an online survey. Whatever means you choose, you could create them and share it to your client or to your customer. And it's required that the lab must have what? A feedback system, a survey. Survey is very, very important. You have a survey, could be a 3-monthly survey, could be a 6-monthly survey, could be a monthly survey. Ensure that survey is analyzed, and that survey, you use it as a area of improvement. It could help you to focus on your areas of improvement. Now, successful customer survey, you have to plan and pre-test it. You have to organize it. The survey must not be biased, it should be unbiased. No leading question, easy to analyze. Results used for what? Improvement. So the results should be used for what? Improvement. What are survey interview tips? Write out questions in advance, pre-test them and validate the question. So before you put out a survey, you must test that survey. Don't ask double-ended questions. Encourage the participant to provide honest response. Ask specific and open-ended questions like, how could the laboratory improve its services to you? Instead of, do you like our lab services? These are specific questions, not ambiguous questions that you could learn. So a question that could be specific and not what? Ambiguous. Focus group discussion. Use small groups like 8 to 10 people. Include people with diverse background and laboratory needs. Start by asking them questions that build trust. Develop a focus group guide for consistency between groups. Ask only open-ended questions, not yes or no. Are we communicating? Now, let's look at this. When we talk about complaint, to every complaint, the dissatisfied customers are, you can see them, the actually dissatisfied customers are always more. People complaining are very few. So those who complain, they are not our enemies. Those who complain are those who want to help us to improve what? Our services. Resolution of complaint. We need to develop what? Procedure for handling and receiving complaint, whether verbal or written complaint. There are some complaints that could be verbal. And when there is verbal, you have to document it in your complaint resolution form. If it's written, you also need to document it and also what? Do a proper root cause analysis. And what? Because the success of the root cause analysis will determine what the corrective actions. So, and when those corrective actions are being put in place, you need to also, let's see that it has been closed. Let's say, for example, now, a client come in and said that his test was not done. And the test was not done. That's the complaint. And he needs a refund, or the test was not done. First, you have to do a root cause analysis. Why was the test not done? You can ask why up to 5 times. By the time you get the proper root cause stated, then what are the corrective actions? Then there must be a process and evidence that refund has been done. If the client needs a refund, so you should also attach the evidence that complaint has been closed. That's one of the difference between it and also a general non-conformity. I will communicate it, then investigate the complaint, as I've said earlier. Are we communicating? Okay, if you can hear me loud and clear, please type on the comment section. You can hear me loud and clear. Okay. So resolution of complaint. When you are trying to resolve complaint, you need to track and record those complaints. Name and the contact and address of the person complaining, whether it's internal or external. Complaint details, like a statement, chronological explanation of the complaint. Complaint suggested resolution, whether the issue had been raised before or not. Track the action and check its effectiveness. That action you have taken to resolve that complaint, is it effective? How will you know that it is effective? If it keeps happening, you know that that's what, or if it's able to solve the problem, you know that it's effective. They provide feedback to the complainant. To whoever that complains, you need to provide what the feedback to him or her. Very, very important. Feedback is very, very important in complaint resolution and evidence that that complaint has what been resolved. Okay, we said out of 26 unhappy customers complain. A lesson here is that the organization should not view the absence of feedback as a sign of what? Satisfaction, because a lot of people may have a complaint and they are not actually saying it to the organization. An active quality management system ensures laboratory meets all client what requirements. Customer information should lead to what? Action. This is very, very important. And this is the beauty. How can we handle a complaint that is not genuine? Well, if we say a complaint is not genuine, the question is that how do you know that the complaint is not genuine? How do you test the genuinity of a complaint? If somebody is complaining a thing, and first of all, you need to have an open mind to the complaint. That's why you must not be biased. Complaint. So you need to have an open mind. You need to have an open mind to it. Then, if it's if it's just a flimsy discussion, you could have a communication with the client or with the client and discuss it with him. But however, very few people that will be satisfied and want to just bring a complaint that is not genuine. To you, it may not be genuine, but to them, it's genuine because most of them are paying for these services. And if they are paying for this service, they demand the best. They demand a whole lot from you that is providing the service. So that's why as much as you can, you should be able to what? Listen to them, see their needs. There's what we call empathy, putting yourself in their shoes. Question that if you were to be the one in their shoes, will you do the same? So sometimes you need to look at it critically and see where they are coming from and be able to resolve those complaints. So customer information should lead to action. When the customer gives you a feedback, you don't just pick the feedback and go and dump it. You don't keep the feedback and keep in view. You don't archive the feedback. You take that feedback and use it as a form of what? Opportunity for improvement. Then actions need to be taken. And this is where process can be improved. And this is where quality comes. Remember that the quality we are talking about is not a destination. The quality is a journey. And if it's a journey, every aspect has to be put into consideration for you to be able to what? Be able to make the most of the journey. So in summary, customer service is an integral part of the quality management system. It's important for the laboratory to have commitment to customer service process, conduct planning and monitoring, understand each client need, provide resources for customer management program. Very, very what? Very, very what? Important. Meeting customer needs is the primary goal of the lab. And active quality management system ensures the laboratories meet all the client requirements. Everyone in the laboratory is responsible for quality and therefore for customer what service. This is very, very what important to what we do. So I will share with you uh like a survey. Okay, you could also do survey for various customers. You could do survey for your walk-in patients, you could do survey for your clinicians, you could do survey for your doctors, you could do survey for your organization. And to test aspect, depending on what you really want to improve on. Then for online, you could use a Google Sheet, create a Google Sheet. You could use a Survey Monkey. Go to www.surveymonkey. You can also use to create one for an online survey. These are the common tools that people use for gathering what surveys. Some developing organization can also use like what we call the chat the box, the feedback box. Now they put a box, people put suggestions, but these days we are more of into technology, so you could just create a Google sheet and put your questions, short questions. Don't make your survey too bulky. It's not research work. People will be discouraged with it. Make it short and simple. 5 questions is okay. 7 questions maximum, and the rest. Make it straight and get their feedbacks. And remember, it is expected that we take we do surveys, do customers and feedback. When customers give us feedback, we need to manage those feedback, do a root cause analysis, do a corrective action, and get back to the complainant, and also close that complaint. And you must have evidence that you have closed that complaint. It's an interesting aspect of quality, customer service, and customer satisfaction. This is the essence of quality. This is the essence of why we hire personnel. This is the essence of why we buy equipment. This is the essence of why we get QCs. These are the essence of why we do validation. This is the essence of why we do a lot what we do within the lab space, so that the customer has to be satisfied. One of the principles of quality management system is customer-centric, customer focus, that the organization must continuously must identify the customer's need and their future need, meet and also exceed what the customers need. Any organization who does not understand customer focus is not bound to enjoy success. What keeps a business, what keeps an organization is the ability for them to continuously meet the customer. And that's the whole essence why we are there. That's what we said earlier. The essence why we are employed, the essence why our salaries are being paid is so that we can satisfy the customers. I hope that is clear. Just a minute, please.